Hi, good evening, my dear students. So now we can discuss the MCQs of pharmacokinetics. So before going to the topic, so let's see what is a pharmacokinetic. Pharmacokinetics means the study of absorption, distribution, metabolism, and excretion of drug. The study of absorption of drug, the study of distribution of drug, the study of metabolism of drug, the study of excretion of drug is called pharmacokinetics. The study of mechanism of drug is called pharmacodynamics. Then, so now let us see the first MCQ. Which route of drug administration provide a rapid response in a patient? Oral, IM, sublingual, subcutaneous. The answer is sublingual. Sublingual has the, so compared to these routes, sublingual has the rapid response after drug administration. Why? Because it has direct bypass. It has a direct bypass to hepatic or liver metabolism. So after that it directly enters to the systemic circulation and gives the quick response. Okay, so based on the rapid response, so here we have the routes of drug administration. So first, intravenous has the rapid response. So here they didn't mention IV. So if they mention intravenous here, so intravenous IV is the first. Okay, first drug which gives rapid response after administration. Okay, the first place, which route has the first place is IV, then intraosseous, then next third place endotracheal, next inhalation, then fifth place sublingual, then after sublingual IM, subcutaneous, rectal, oral, last dermal. Okay, the next question. The study of absorption, distribution, metabolism, and excretion of drug is called pharmacokinetics. The next question. What kind of substance cannot permeate membranes for passive diffusion? By passive diffusion. Lipid soluble, non-ionized substances, hydrophobic substances, hydrophilic substances. The answer is D. Hydrophilic substances. So these are the substances can't permeate membranes by passive diffusion. So actually, active transport in these hydrophilic substances always takes place by active transport only, not by passive transfusion. Okay, the next one. Most important route of excretion of drug. Most important route of excretion of drugs. Through kidney, saliva and sweat, exhaled hair, fecus. The answer is A. Kidney. Kidney is the most important route of excretion of drugs. The next one. The rate of drug absorption is greater in the large intestine, stomach, gallbladder, small intestine. Large intestine, stomach, gallbladder, small intestine. And the answer is small intestine. Small intestine has the high drug absorption. The next one. Maximum sodium reabsorption occurs at. Maximum sodium reabsorption occurs at proximal tubule, loop of Finnin, distal tubule, collecting duct. And the answer is proximal tubule. Okay, the next one. The client on coumarin therapy should be instructed to avoid which of the following over-the-counter medication? NSAID, non-steroid anti-inflammatory drugs, cough medicines, histamine blockers, laxatives, containing magnesium salt. NSAID, cough medicines, histamine blockers, laxatives containing magnesium salt. And the answer is non-steroidal anti-inflammatory drugs. The client who is on coumarin therapy, so the client has to avoid to take this non-steroidal anti-inflammatory drug. The next question, atropine is used in organophosphate poisoning because it reactivates acetylcholinesterase, competes with acetylcholine release, bind with both nicotinic and muscarinic acetylcholine receptors, is a competitive antagonist of acetylcholine. The answer is it is a competitive antagonist of acetylcholine. Actually, this organophosphate poison has the capacity to block the, okay, not break. So it has the capacity to block the breakdown of acetylcholine. Nothing but it makes binding of acetylcholine in the body. Organophosphate makes binding of acetylcholine in the body. Accumulation of acetylcholine causes sweating, salivation, bronchoconstriction, bradycardia. So this atropine drug has the power to block the binding of acetylcholine. So that's why it acts as a antagonist for organophosphate poison. So this is about MCQ of pharmacokinetics. Thank you.